This is Arkies in the Beltway, your look at national politics and the Arkansans influencing the discussions. I'm Alex Thomas, Washington correspondent for the Arkansas Democrat-Gazette, reporting from the nation's capital. Thank you for joining us for this edition of Arkies in the Beltway for the week of October 12th, 2025. The government shutdown will continue into a third week with no end in sight. Senators left Capitol Hill last Thursday after failing multiple times last week to advance legislation to reopen the government. Senate Republicans have been pushing the House's continuing resolution to restore funding through November 21st. Their Democratic colleagues, however, want Congress to address tax credits for the Affordable Care Act marketplace before the subsidies expire at year's end. Senators will return to Washington on Tuesday as Monday is a federal holiday. The House will remain away from Capitol Hill for a fourth straight week. The chamber has not held legislative business since September 19th. House Speaker Mike Johnson says House Republicans did their part to fund the government.
We will come back here and get back to legislative session as soon as the Senate Democrats turn the lights back on. That's the fact. That's where we are.
Federal agencies have started firing employees, a move to place more pressure on congressional Democrats to end the government shutdown. The White House Office of Budget and Management ordered the reduction in force plans, laying off workers affected by the funding lapse. The Congressional Budget Office estimates around 750,000 federal employees will not work during the shutdown, as their assignments are non-essential services. At the center of the shutdown dispute, what to do about premium tax credits for health insurance purchased through the Affordable Care Act marketplace. These tax credits have existed since the ACA start, but in March 2021, amidst the coronavirus pandemic, then President Joe Biden and Congress increased the size and eligibility of these subsidies. The enhancement was supposed to expire after 2022, but Congress agreed to extend the changes through 2025. Camille Rochelle with Arkansas Advocates for Children and Families says these tax credits have been important and well utilized.
During this time, it was very, very important to try to do things that made coverage more affordable. And so those, premium tax credit enhancements made that possible.
Around 93% of Arkansans with health insurance plans through the ACA marketplace received premium tax credits for this year. According to the U.S. Centers for Medicare and Medicaid Services, the average premium tax credit for Arkansas ACA consumers around $508 per month. Rochelle says people will face higher healthcare costs if these tax credits are not available.
It is going to be much harder to keep families, covered in marketplace coverage if Congress doesn't act.
Ann Shoup is a senior advisor with Protect Our Care, a national healthcare advocacy group created in response to Republicans' previous efforts to repeal the Affordable Care Act. She says enrollment in healthcare insurance has increased with the enhanced premium tax credits in place. In Arkansas, more than 64,000 people selected plans during the 2021 open enrollment period. This year, almost 167,000.
More people were covered than ever. So we're really starting to see the promise of what the Affordable Care Act could really be, which is to ensure that everybody can have coverage.
Members of Arkansas's congressional delegation tell the Democrat-Gazette that Congress should debate an extension rather than continuing the enhancement through a short-term funding measure, such as the proposal by their Democratic colleagues. The debate over the enhanced premium tax credits is occurring just weeks before open enrollment starts. Rochelle notes some enrollees have already started looking at plans for next year. Others may not be aware about the potential change in cost.
I have no idea how, the average person who doesn't work in health policy knows what's going on, in between all of their other life duties, their own work, their own caring for their families, and all the other stresses they have in their life, may not know that my health premiums may be going up $400 in January.
Many Arkansans will face higher health insurance costs in the new year, regardless of what happens to the enhanced premium tax credits. Arkansas Blue Cross and Blue Shield and Centene will increase premiums by an average of 22%. These changes follow negotiations with Governor Sarah Huckabee Sanders over higher proposed rates. Some government programs have continued during the government shutdown with minimum interruptions, but this may not last if the shutdown goes into November. The nation's leading nutrition assistance programs, SNAP and WIC, are funded through the annual appropriations process rather than mandatory spending. State agencies managing these programs say there are enough dollars to cover benefits through October. Around 240,000 Arkansans participate in SNAP, which provides low-income households with benefits to purchase food. Sylvia Blaine with Arkansas Hunger Relief Alliance says food banks in the natural state have been operating with speculation over the future of food assistance.
What we hope to do is make sure that we're expressing the need and looking for partners, whether it be corporate partners, partners from the faith community, other nonprofits that can step up and help us with a solution.
The White House is looking at moving tariff revenue to support WIC, which allows low-income people who are pregnant, mothers, infants, and young children to access food and social services. Around 65,000 Arkansans receive WIC benefits. The Arkansas Department of Health received additional funds last week to deliver WIC services through October, the agency telling the Democrat-Gazette that it is working to identify all available options to continue delivering services into the future. In campaign news, Chris Jones has made his future plans official. Jones launched his bid for Arkansas's 2nd Congressional District last Thursday, hoping to take on Republican incumbent French Hill in next year's midterms. Jones ran for governor 3 years ago, making Arkansas history by becoming the first black gubernatorial candidate representing a major political party. Educator Zach Huffman entered the 2nd District's Democratic primary over the summer. As for Hill, he faces a primary opponent of his own, business and political consultant Chase McDowell. We end this week's episode of Arkies in the Beltway with a note about Danny Shamir, the Democrat-Gazette's Metro editor who died last week following a battle with pancreatic cancer. Shamir joined the Arkansas Democrat in 1988 and stayed with the news organization following the merger with the Arkansas Gazette in 1991. He was known in the newsroom for his staunch support for open records and government transparency, as well as his love for baseball and the music of Bob Dylan. And as I told a colleague last week, with some journalists, it's easy to see their passion for good reporting and dedication to public service just by how they operate in the newsroom. Simply put, Danny was one of those journalists. He was 67 years old. And with that does it for this week's episode of Arkies in the Beltway. Thank you for listening, and we'll see you next week.